Hello Emma, nice to meet you.
Hiya.
I'm Catherine, I'm one of the midwives here in Daisy Hill, and I'm going to give you a tour of the facility here, the maternity facility here in Daisy Hill today.
Brilliant,
All
yeah.
right, I'm sure you've lots of questions.
Yeah.
First baby, and a lot of questions, a lot of excitement,
Absolutely, yeah.
a lot of anticipation.
Very nervous.
This is the first stop on our tour of the maternity unit at Daisy Hill today, and I see you've brought your green notes with you, and that's very important because those are the documentation sort of how your pregnancy has progressed and your medical history, and we need them to assess what we're going to do now that you've presented yourself probably in labour. When you report here, the midwife will usually sort of take your notes, and they'll ask you to wait out there just in the waiting area that we passed, and then they will call you as soon as they can. Okay Emma, so this is the actual assessment room in the assessment unit, or one of them, where you could be taken to assess the condition of yourself and your baby.
Okay, yeah.
Don't be alarmed by the equipment, that's just for checking your blood pressure, and that's just if we need to monitor the baby's heart rate and your contractions.
All right, okay. So this is where I'd come first then.
This is where you'd come first, and then a decision would be made whether it would be appropriate for you to go home and await events, or whether you would need to be admitted directly to delivery suite, or whether you would need to be admitted to maternity floor, to one of the 4-bedded units there on the antenatal side. Now Emma, these are just the outer doors of delivery suite here, and if you just come on ahead in then. Okay. This whole area here is the delivery suite, and first of all, because we're in a clinical area here, we'll sanitise our hands. It's very important to do that here. And this is our birth pool room. Right, now. There's quite a bit of equipment in it, but don't be alarmed, sort of we need this for the purposes that we're prepared for absolutely anything that happens. This is the bed, but we normally like to keep you up and about and mobile as much as possible. You don't have to be standing upright all the time, but you can actually you can lean over the bed, you can but just stay moving about as much as you can. We do have a rocking chair that you can actually sit on. It's about gravity helping you and helping sort of get the baby into the right position.
All right, okay.
Now these are some of the other aids that we have here. We have the mat here that you can go down on all fours. But as I say, you don't have to go down on all fours because our bed actually will let you do that. And this is the ball, which is absolutely excellent for you to sit on, and you can actually bounce up and down on this ball, and this also sort of helps to get the baby into the right position. And as you can see, most of our ladies sort of sit on and sort of find this, very, very good, very relaxing. And we usually have daddy behind, just to make sure that you don't sort of bounce off. This is our birthing stool here, which is very good sort of for getting the baby's head down into the right position for delivery. This is the pool here. This is sort of the dominant feature of this room, because this room is for low risk ladies, let's say. That's somebody that hasn't had any medical problems or any problems during their pregnancy and have come in spontaneous labour. Water is a very good form of pain relief. Some people talk about it being the aquadural, that they find it very good sort of to relax. Before you even get in here, you can use water at home in the early stages of your labour, or you can use the bath. There's baths upstairs. Pain relief that's available when you're in the pool is the water itself, and some people find that enough for them, and it just helps to relax them. Or we can use the Entonox, and the Entonox is piped with one of the tubes, sort of that you breathe it in and out through your mouth. Okay. And it's not accumulative. Once you stop breathing, sort of it goes away, so you're not building anything up with the baby. And a lot of people find that adequate. Now, if you find that you're needing more pain relief and you need something like the pethidine or the diamorphine, which are given by injection form, then we need to take you out of the pool before we give it to you and for the duration of that. Yeah. But you can still be mobile, you can still be upright, but it tends to make you quite sleepy. Okay. And then if you still find that that's not adequate, then you may need epidural, but we wouldn't administer an epidural in this room. We would use one of the more clinical rooms for that.
So with the birthing pool then, it would just be myself then in the bath?
Yes, just yourself in the bath. Now, as I say, if you had a particular preference for your partner to be in with you, I'm sure that could be looked at the time, providing he brings his swimming trunks with him.
And it's easy enough to get in and out of then?
They have the steps here to get you in and out of, and you can sit up at any time, but if you want to, sort of, we can give you a wee hand to sit up as well.
Yeah.
The only thing I would say to you, if you're thinking of using the water, bring an old t-shirt or a bra or something just to wear, because your nightie isn't suitable because it'll be absolutely drenched. So something sort of that covers your modesty. If you like. We don't mind, but usually most ladies don't like to be completely exposed in the pool. We have our cot here sort of when your baby arrives. This is our wee sonicade that we listen in. If you're in this room, you're a low risk lady, so therefore we listen in intermittently to your baby's heart rate, and we can do that in the pool. Sort of, you just sort of bring your tummy to the surface, and then we have a wee listen in. And the midwife will be doing that on a regular basis.
Yeah, is that the same that they would use when the checkups?
Yes, exactly the same as they use in the checkups. Indeed, we do monitor your blood pressure here, and we do that sort of intermittently as well, just to make sure that you're okay and that you're not getting too stressed. We try to make it as home from home as we possibly can, so therefore you can bring in whatever music you want. Alternatively, some ladies sort of like it to be very quiet. They like the lights dimmed and they like to get into their own zone. In your notes there, you'll note sort of that you can do your birth plan.
Okay.
And it's really your wish list, what you would like for birth and delivery, and we will do our best to adhere to that. It's not written in stone because sometimes things happen that we need to intervene, but we will discuss them with you as we need to.
Okay.
This here is a resuscitator. We don't often need to use it, but babies don't come out pink. They sometimes can be a wee bit grey or a wee bit blue, and sometimes need a little shot of oxygen just sort of to get them going. But most times we deliver the baby up onto your abdomen, we dry it, and the baby sits there, and we nurse the baby in skin to skin position. And this actually is very good for you. It helps promote breastfeeding. It controls the baby's heart rate, its temperature and its breathing. It's also very nice from your point of view insofar as it calms you down as well after the whole ordeal of labour, because it is quite a hard day's work. Now Emma, this is the bed here, and whilst we encourage you to remain upright, we don't mean that you have to stand up all the time, but it is important sort of that you move around sort of at will or when you choose to. This bed here sort of affords you the opportunity that if you are tired, you can bring the bed up and you can actually just lean over the bed. And that's sort of very, very good, very therapeutic. And then you can rock your hips, and that also helps to get the baby sort of into the right position. And sometimes you just sort of sway, and that sort of helps. It also helps to relax you. The bed actually comes up into a sitting position, so that you can go up on all fours. Or you can actually, the bed will go into an armchair shape as well if you want to sit. So therefore that is maintaining your upright position, sort of to get the baby into the right position for delivery. So just to let you know sort of that if you don't want to sit on the rocking chair, but you can sort of put you into sitting position on the bed. So Emma, this is the postnatal area on this maternity ward here. You usually stay down in delivery suite for about an hour after you've had your baby. This is our typical 4-bedded unit here. You'll have a bed. You will be going home sort of fairly soon after the baby's delivered, usually the next day. Our visiting times are sort of for everyone from 3 to 4 in the afternoon and from 7:15 to 8:15 in the evening. Okay. And also your partner or your husband can visit from 10 in the morning to 9:30 at night. Here in Daisy Hill we practice what used to be called rooming in, but now it's called keeping your baby close. And that's as your baby stays with you for the duration of your stay here.
Okay, yeah.
That helps to promote breastfeeding. All the healthcare assistants here and the midwives are trained to help you breastfeed, and there are a number of support groups out in the community to help you, as well as the community midwife, and these sort of have meetings sort of right throughout the trust area. There's also a leaflet of peer support workers that will offer you some help either by phone or in cases they can visit your house. They've all been vetted by the trust, so they will be given the leaflet on discharge. Just to say to you that there is a buzzer here. We always give this to ladies when they come back up from delivery suite, and you just press it and that will buzz at the desk. Okay. I always ask you to summon help if you're going to get out of bed for the first time, just in case you feel a wee bit weak or faint or anything like that. The other thing is you can summon help if you need help with breastfeeding. Okay.